Hello everyone, now let us discuss about 2023 CPT coding guidelines for female genital system. This comes under surgery, and in the current session we will be discussing about the CPT range 56,405 to 57,426. Coming to the CPTs regarding vulva, perineum and introitus. Now let us discuss the definition. What is simple procedure, radical procedure, partial procedure and complete procedure. The following definitions apply to vulvolectomy codes, which are in the range 56620 to 56640. A simple procedure is the removal of skin and superficial subcutaneous tissues. Next, a radical procedure is the removal of skin and deep subcutaneous tissue. Whenever deep subcutaneous tissue is removed, you must assume it is a radical procedure. Next, coming to partial procedure. A partial procedure is removal of less than 80% of the vulvar area. A partial procedure is the procedure for removal of less than 80% of the vulvar area, and a complete procedure is removal of greater than 50% of the vulvar area. Now coming to the CPTs for incision. Before that, for incision and drainage of sebaceous cyst, furnacle or abscess, you need to refer 10040, 0060 and 0061. The next is 56405, incision and drainage of vulva and perineal abscess. And the next CPT is 56420, incision and drainage of Bartholin's gland cyst. And for incision and drainage of Skene's gland abscess or cyst, you need to refer 53060. The next CPT is 56440 for marsupialization of Bartholin's gland cyst. Here, a pouch is formed. Whenever the physician documents any formation of pouch, you need to refer or you need to code 56440. The next is 56441, lysis of labial adhesions. The next is 56442, hymenotomy, simple incision. Let us see an example. A patient presents with recurrent infection of Bartholin's gland, which has been previously treated with antibiotics and incision and drainage. At this visit, her gynecologist incises the cyst, draining the material in it, and tacks the edges of the cyst, open pouch, to prevent the recurrence. Here it is treated by tacking the edges of the cyst, open pouch, to prevent the recurrence. So the appropriate CPT is 56440, marsupialization of Bartholin's cyst. Next, coming to destruction CPTs, the first one is 56501, destruction of lesion vulva simple. The next is 56515, destruction of lesion vulva extensive. Procedures are same. When it is simple, the CPT is 56501. It can be laser therapy, electrosurgery, cryosurgery or chemosurgery. And when it is extensive, the CPT is 56515. Now let us see an example. Patient with genital warts has cryotherapy of an extensive number of lesions on her mom's pubis labia and perineum. How is this procedure coded? Here, destruction of lesion vulva extensive is done using cryotherapy. So the CPT is 56515. Coming to excision CPTs, the first one is 56605, biopsy of vulva or perineum, one lesion. And this is an add-on code, plus 56606 for each additional lesion. Next CPT is 56620, vulvectomy simple. The definition of simple and partial we have discussed earlier. Vulvectomy simple and partial means the CPT is 56620. Vulvectomy complete means the CPT is 56625. The next is vulvectomy radical partial. The CPT is 56630. Next, vulvectomy radical with the unilateral inguinofemoral lymphadenectomy. The CPT is 56631. When vulvectomy radical with bilateral inguinofemoral lymphadenectomy, the CPT is 56632. And for partial radical vulvectomy with inguinofemoral lymph node biopsy without complete lymphadenectomy, the CPT is 56630 in conjunction with 38531. Next is 56633 vulvectomy radical complete, and 56634 for vulvectomy radical complete with unilateral inguinofemoral lymphadenectomy. Next 56637 for bilateral inguinofemoral lymphadenectomy. Vulvectomy radical complete with bilateral inguinofemoral lymphadenectomy. Next CPT is 56640 vulvectomy radical complete with inguinofemoral iliac and pelvic lymphadenectomy. And for bilateral procedure, report 56640 with modifier 50. Next is 56700 partial hymectomy or revision of hymenal ring. The next is 56740 excision of Bartholin's gland or cyst. This is excision of Bartholin's gland or cyst. The CPT is 56740. Coming to repair CPTs, the first one is 56800 plastic repair of introitus. The next is 56805 clitoroplasty for intersextate. The next is 56810 perineoplasty repair of perineum non-obstetrical. Now coming to endoscopy CPTs, the first one is 56820 colposcopy of uvula. For colposcopy of uvula, the CPT is 56820. For colposcopy of uvula with biopsy, the CPT is 56821. And for colposcopic examinations of procedures involving the vagina, we need to refer 57420 and 421. And for cervix, it is 452 and 461. From 57452 to 57461. Coming to CPTs regarding the vagina. The first one is incision. The first CPT is 57000 colpotomy with exploration. Next is 57010 colpotomy with drainage of pelvic abscess. The next is 57020 colposynthesis. The next is 57022 incision and drainage of vaginal hematoma obstetrical or postpartum. The next is 57023 incision and drainage of vaginal hematoma non-obstetrical. For example, postpartum spontaneous bleeding, etc. Post-trauma, non-obstetrical means post-trauma spontaneous bleeding, etc. Now coming to CPTs for destruction, the first one is 57061 destruction of vaginal lesions, simple, either by laser therapy, electrosurgery, cryosurgery or chemosurgery. Extensive, the CPT is 57065 destruction of vaginal lesions, simple, the CPT is 57061. Extensive, the CPT is 57065. Now coming to excision CPTs. The first one is 57100 biopsy of vaginal mucosa, simple. Next 57105 biopsy of vaginal mucosa, extensive, requiring suture including the cyst. The next is 57106 vaginectomy, partial removal of vaginal wall. The next is 57107 vaginectomy with removal of paravaginal tissue. The next is 57109 vaginectomy with removal of paravaginal tissue, radical vaginectomy with bilateral pelvic lymphadenectomy and para-aortic lymph node sampling. Now let us see an example. A 48-year-old woman presents with vaginal bleeding for the last 15 days. Upon examination, there is a mass approximately 3 into 4 centimeters hard and irregular on the upper vaginal wall. A small amount of tissue was obtained from vaginal wall and sent to pathology. So biopsy of vaginal wall has been done. So 57100 is the CPT, which includes biopsy of vaginal mucosa simple. Now coming to excision CPTs, the first one is 57110. Vaginectomy, complete removal of vaginal wall. Next 57111. Vaginectomy with removal of paravaginal tissue. Radical vaginectomy. The CPT 57112 has been deleted. This is a new thing. 57112 has been deleted. The next is 57120. Colpocelysis. Lee Forte type. Next 57130. Excision of vaginal septum. The next is 57135. Excision of vaginal cyst or tumor. CPT for excision of vaginal cyst or tumor is 57135. Now coming to introduction CPTs. The first one is 57150. Irrigation of vagina and or application of medicament for the treatment of bacterial, parasitic and fungoid diseases. The next is 57155. Insertion of uterine tandem and or vaginal ovoids for clinical brachytherapy. The next is 57156. Insertion of a vaginal radiation afterloading apparatus for clinical brachytherapy. The next is 57160. Fitting and insertion of pessary or other intravaginal support device. The next is 57170. Diaphragm or cervical cap fitting with instructions. The next is 57180. Introduction of any hemostatic agent or a pack for spontaneous or traumatic non-obstetrical vaginal hemorrhage. Now let us see an example. A 47-year-old patient presents to her OB or gynecologist for fitting and insertion of pessary for uterine and vaginal prolapse, having given birth to 6 healthy children. The CPT is 57160. Here, fitting and insertion of pessary, vaginal pessary is performed. So the CPT is 57160. Fitting and insertion of pessary or other intravaginal support device. Now coming to repair CPTs, the first one is 57200. Colporaphy, suture of injury of vagina, non-obstetrical. It is not related to pregnancy. The next is 57210. Colpoperineorrhaphy, suture of injury of vagina and or perineum. This is also non-obstetrical. The next is 57220. Plastic operation on urethral splinter vaginal approach. For example, Kelly urethral application. Next CPT is 57230. Plastic repair of urethrocoel. Next is 57240. Anterior colporaphy, repair of cystocele with or without repair of urethrocoel, including cystourethropy when performed. And do not report 57240 in conjunction with 52000. The next CPT is 57250. Posterior colporaphy, repair of rectocele with or without perineorrhaphy. And for repair of rectocele without posterior colporaphy, we need to use 45560. Next CPT is 57250. Posterior colporaphy, repair of rectocele with or without perineorrhaphy. For repair of rectocele without posterior colporaphy, we need to use 45560. The next is 57260. Posterior colporaphy, combined antero-posterior colporaphy, including cystourethropy when performed. For combined antero-posterior colporaphy, the CPT is 57260. For only posterior colporaphy and repair of retrocele with or without perineorrhaphy, the CPT is 57250. The next is 57265. Combined antero-posterior colporaphy, including cystourethropy when performed with enterocele repair. The next is an add-on code 57267. Insertion of mesh or other prosthesis to repair of pelvic floor defect. Each side, anterior, posterior compartment, vaginal approach. Next is 57268. Repair of enterocele, vaginal approach. Next 57270. Repair of enterocele, abdominal approach. The next is 57280. Colpexy, abdominal approach. Colpopexy, abdominal approach. The next is 57282. Colpopexy, vaginal approach, extraperitoneal approach. The next is 57283. Colpexy, intraperitoneal approach. Next is 57284. Paravaginal defect repair, open abdominal approach. Paravaginal defect repair, including repair of cystocele if performed, open abdominal approach. Next is 57285. Paravaginal defect repair, vaginal approach. The next CPT is 57287. Removal or revision of sling for stress incontinence. The next is 57288. Sling operation for stress incontinence. And whenever laparoscopic approach, for laparoscopic approach, you need to use 51992. Next is 57289. Pereira procedure, including anterior colporrhea. The next is 57291. Construction of artificial vagina without graft. And for construction of artificial vagina with graft, the CPT is 57292. The next CPT is 57295. Revision including removal of prosthetic vaginal graft, vaginal approach. Next is 57296. Revision including removal of prosthetic vaginal graft, open abdominal approach. And for laparoscopic approach, you need to use 57426. The next is 57300. Closure of rectovaginal fistula, vaginal or transanal approach. Next is 57305. Closure of rectovaginal fistula, abdominal approach. Next is 57307. Closure of rectovaginal fistula, abdominal approach with concomitant colostomy. Next is 57308. Closure of rectovaginal fistula, transperineal approach with perineal body reconstruction with or without levator application. The next is 57310. Closure of urethrovaginal fistula. Closure of urethrovaginal fistula. The next is 57311. Closure of urethrovaginal fistula with bulbocavernous transplant. Next is 57320. Closure of vesicovaginal fistula, vaginal approach. And for closure of vesicovaginal fistula, transvesical and vaginal approach, the CPT is 57330. And for abdominal approach, closure of vesicovaginal fistula, abdominal approach, the CPT is 51900. Next is 57335. Vaginoplasty for intersextate. Coming to manipulation CPTs, the first one is 57400. Dilation of vagina under anesthesia. Next is 57410. Pelvic examination under anesthesia other than local. The next is 57415. Removal of implanted vaginal foreign body under anesthesia. And for removal without anesthesia of an implanted vaginal foreign body, you need to use the appropriate E&M code. Now coming to endoscopy or laparoscopy CPTs. The first one is 57420. Colposcopy of entire vagina with cervix if present. The next is 57421. Colposcopy of entire vagina with biopsy. Colposcopy with biopsy of vagina or cervix. And for colposcopic visualization of cervix and adjacent upper vagina, you need to use 57452. And when reporting colposcopies of multiple sites, use modifier 51 as appropriate for colposcopic examination or procedure involving uvula. And for computer aided mapping of cervix uteri during colposcopy, you need to use 57465. And for endometrial sampling performed in conjunction with colposcopy, you need to use 58110. The next CPT is 57423, paravaginal defect repair, including the repair of cystocele, if performed laparoscopic approach. The next is 57425, laparoscopy surgical colpopexy, that is suspension of vaginal apex. The next is 57426, revision including the removal of prosthetic vaginal graft, laparoscopic approach. And for vaginal approach, the CPT is 57295. And for open abdominal approach, the CPT is 57296. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.